anatomy, maybe this development, you may get a question in MCQs and this thing you may get. Okay, so go through them, and then for ROSPI and this MEQs, you will not be getting questions, okay, from development. But for your this thing, please make sure you read gross anatomy topics, surface anatomy, and then circulation of the heart, circulation. These are the topics, high yield topics, which you should be focusing on. Understood? And then not much now mind this mediastinum and all these things. Please make sure you read only the boundaries and contents and those kind of but not contents not needed, but maybe for MCQs you may need to go through them. Okay. Other than that, not much now from my topic, not much from CVS. Maybe Prof will have something to talk to you about that. What other topics I had with you on this? Maybe 1 second now. Oh, 1 second. So skimming. Just give me a minute. Okay, 1 second. I'll share. See, this one I've already discussed this with you, right? During the tutorials, we might have discussed this. Like these are all the auscultatory areas for different these things. So these things are important because if there is any question on any valvular deformity, then we may ask you, okay, then where is it here? Where is it heard? Or this valve, where is the normal sound here? So this is all the surface anatomy. So if you look at this, this will be the location of the valves or orifices, while this will be the auscultatory side. So these things can be asked sometimes, and these things also all important, like which artery supplies where and these things. This slide is important as well, because sometimes they can ask you if it is about pain over the chest wall, how is it transferred, or medial side of the arm, how is it transferred. It doesn't mean when I show you it is the exact question you're going to get, but the thing is, these are the ones normally from anatomy, this clinical points, whenever they ask you, these are the things they'll ask you. But these things might not have been stressed clearly in the classroom setting, so you might be missing out on these things. Okay, so this particular slide and the auscultatory area slide, you should be focusing more. Understood? Okay, guys. Okay, doctor. So in this case, I'll give something, not much. No, in this case, so those are the two slides I wanted to show you as far as CVS is concerned. And CVS, Dr. Faslin is not available. Maybe during next revision session, she can talk about it, but I've told you what you're supposed to read as well. Okay. So you don't need to wait for her to come back and let you know what you need to know, but please go through the gross for even the specimen, mention not the specimen, the model, and as well as the questions on gross anatomy of the heart and circulation of the heart. Very, very important. Valves, again, similarly, well, like as I have told you, These are the most important ones. Then shall I move on to the respiratory system? Mine others. The whole topic, I don't want to spend so much time here because there may be one MCQ from the thoracic cage and an MCQ or EMQ from thoracic cage and these things. Okay. You need to know the clinical aspect of whatever I have stressed enough in the class that might be asked. Other than that, not much from that session. Okay. So in respiratory system, did I teach you respiratory system last year? Oh, lung and pleura was mine, right? Okay, I'll let you know. In respiratory system, please make sure you guys learn the just what is, is this the slide which I shared with you last time? Or this was an older one, I'm not sure. This one, maybe in this case, trachea, not much important. You don't need to worry too much about them. About pleura, you should understand that the lung is covered by, if this is the lung, it is covered by two layers of pleura. The one on the outer surface is called the parietal. The one which surrounds the lung will be the visceral layer. So as you can see in this, the orange one is the visceral layer. The other outer one is the parietal layer. And the parietal layer will be given different names according to the area where they are found. For example, if it is surrounding the apex or if it is seen, so it is called the apical pleura, the one which is surrounding by the ribs. So that will be called as the, these things you will know. One second. You see costal parietal pleura, or it is called the diaphragmatic pleura as it is covering the diaphragm over here, or it is also called mediastinal pleura, the one which is seen on the medial surface. It's called the mediastinal pleura, and the one which is on the top, which will be called the cervical pleura. So these are the the different parts of the pleura covering the lungs. Okay. So what exactly is important for your exam point of view? So the root of the lung is the things which are entering into the lung surrounded by this pleura over here. This gives you the root of the lung. So contents, no need to exactly remember what is in the front, what is at the back. Don't worry too much about them. But what you need to know is you need to know the contents what are inside. Like say from each side you do have two pulmonary veins. You have one pulmonary artery entering them, and also you do have bronchus, which on the right side there will be, so you'll have bronchus, you'll have pulmonary artery and pulmonary veins, and surrounding the bronchus you have bronchial artery and the vein as well. So these are the some of the contents which you should know that are located in the lung root. So recesses, meaning the extra space between the parietal pleura and the visceral pleura, where the between the border of the lung and the pleura, the gap is there, right? So this is where sometimes fluids can accumulate, but normally this recess is called costomediastinal. Costomediastinal will be on the medial side. This will be the costodiaphragmatic recess. Okay, so the extra space between the border of the lung and the margins of the pleura. Usually there will be only about a few centimeters or millimeters over space will be there. But in these regions, you do have some additional space. So that is why they are called a recess. Okay, so normally where you, as you can see in this picture, you see this is the lower. Can you see the pointer in mine? Or you're not able to see?
Yes.
Now I can show you just now. So you can see this is the lower border of the lung. This is the lower border of the pleura. So the gap is called the recess. Okay, for example, if you look at the lower border of the pleura, it will be sixth rib, eighth rib, and 10th rib, meaning sixth rib in the anterior axillary line over here, eighth rib in the mid axillary, not anterior axillary line, in the mid clavicular line, you can say sixth rib. In the mid axillary line, it will be around the eighth rib. So if you make a point, if you mark a point on the sixth rib in the anteriorly, eighth rib in the mid axillary line, 10th rib in the posterior part, if you connect these three dots, that forms the lower border of the lung. But for pleura, there will always be around two rib gap. Say, for example, if it is sixth rib here, eighth rib for the pleura over here. If it is for eighth rib, the lung is at the lower border. For the pleura, it will be slightly lower down, 10th rib. So you see, a lower limit of lung will be sixth, eighth, and the 10th rib. Sixth rib, 10th, eighth rib, and 10th rib. But look at the pleura, it will be at the level of 8th rib, 10th rib, and 12th rib. So everywhere in the lower margin, if you see throughout the lower margin, there will always be a two rib gap between the lower border of the lung and the pleura. So normally it is not an issue. This is important because when the lung is expanding, this space gives you enough space for the lungs to expand. But what happens when it gets filled up with fluid? That is when the problem starts. So because it is a potential space, it is very natural that sometimes due to some diseases, the fluid can accumulate in these gaps. Okay, that is the importance of knowing these recesses. Nerve supply, just read about this. Parietal will be supplied by intercostal and phrenic nerve, while visceral will be supplied by autonomic nerves. Okay, so clinical anatomy, you want to poke in to drain the fluid. So where you poking in the gap between these two ribs in the intercostal space, especially in the ninth intercostal space, that is where you poke in. So you will be entering into that. Okay, so lungs, as far as lungs are concerned, in this module, particularly focus on, no need to remember the too much about them, all the other phases. But what you need to know is, you need to know about the mediastinal relations. What are the structures that form impressions on the right lung? What are the impressions that are formed on the left lung? So about the cardiac arch and the aortic arch, descending thoracic aorta, once you take them out in the lung, you can see these impressions. So these are important in case of lungs. And what else is important is, you need to know about the lobes and fissures. Lobes and fissures, again, important because on the right side, you have oblique fissure and horizontal fissure. As a result, you have three lobes. On the left side, there is only one fissure, which is the oblique fissure. So you have only two lobes, upper lobe, superior lobe, and inferior, or upper and lower lobe. Okay, so you need to know the surface anatomy for oblique fissure and the horizontal fissure as well. So this particular slide, please make sure you read them well, because this is important. So this and these two slides, lobes and fissures, are the two slides which you should be focusing more when you read about the lungs. Okay, so what is the horizontal fissure? Follows the curve of the fourth rib, while oblique fissure from begins anteriorly in the fifth intercostal space and ends medially deep to sixth costal cartilage. So you can read about them. Bronchopulmonary segments, again, you should know about bronchopulmonary segments. So 10 segments, how they are placed, about in detail about pulmonary segments. So lobes and fissures, the surface anatomy of the fissures, and then the bronchopulmonary segments. These are the most important ones. Then you need to know about pleura and the recesses mainly. Okay, you don't need to know individually about the parts like say apex and all the details about them, the surfaces, borders, no need to know about them in detail. Okay, but bronchopulmonary segments, and those are the ones which you need to know. Blood supply, like normally lungs will be supplied by two types of arteries. Pulmonary artery is going to be bringing in the deoxygenated blood, right? Because they supply the respiratory part. That is where exchange of gases will be taking place. So the pulmonary arteries will be bringing in deoxygenated blood, while the bronchial arteries will be bringing in the oxygenated blood to all the other cells in the lungs. Okay, so that is the one. And you do have bronchial veins taking up, and lymphatic drainage, especially on the right side to lymphatic duct, and finally to the thoracic. Right lung will drain into right lymphatic duct, while the left lung will drain into thoracic duct. That's the one. Don't worry about nerve supply. Especially what is important is you can't feel anything in the lungs, right? Like the parietal pleura is somatic nerve supply, meaning if I poke the parietal pleura, you will feel the pain. But the visceral pleura, the lung, everything, like your viscera, any viscera, they are pain insensitive because they are all supplied by autonomic nerves. So in this case, you can see they are supplied by both parasympathetic and sympathetic. Parasympathetic is by vagus, sympathetic is by upper 4 or 5 thoracic ganglia. Okay, sensory is by parasympathetic nerve. So what are the difference between right and left lung? This is for you to have an idea like how they are differentiated between the right and the left lung. This is the slide which gives you a summary of all the differences between right and the left lung. Are we clear with this? So in this case, please know about the parietal pleura, visceral pleura, nerve supply, and the recess, costo-diaphragmatic recess, especially costo-mediastinal, even though it's important, not much as clinically important, but the costo-diaphragmatic recess is clinically important. When you read about the lungs anatomy, please focus more on the lobes, the fissures, the surface anatomy of the fissures, and the bronchopulmonary segments. Okay, that is all you need to focus on here. Any doubts in this? For this particular respiratory system, please focus more on the histology aspects. Okay, histology topic, please focus on the in gross anatomy of the lung. This is what you need to focus on because your MEQs are going to be in and around these things. Okay. For RESPI, maybe later I'll ask them next week. I'll ask them to take out all the importance models and specimen which you should be focusing on. I'll ask them to place 2 sets of each of them in the dissection hall. So during your time, you guys can come up and you guys can go through the things. Okay. So you might have a lot of pictures of the same model and all those things from your notes. So you can just revise them using them. Okay. Anything else? If not, then I'll ask Prof. Um, Tinmo to join the session. Okay.
Doctor,
Yes.
for your topic, it is actually upper respiratory tract.
Guys, you should have told me no. That's what I was thinking. The slide seems to be older. Because this maybe last to last year I had this. So okay. Uh, then you guys are sitting simply over there. You could have told me in the beginning. Why do you want to waste this thing now? Just now I saw somebody message. Oh, you guys also, it's been long time, so you guys would have forgotten whether this class was taken also, right? Do I have this in the, this is long before I had this. Okay, it's all right. Because we tend to rotate the topics among us and these things. So that is why. 1 second. Just give me upper. Oh, now I see. Upper respiratory tract normally, but anyway, Prof, when she comes in, also you can check that anyway she'll be talking about this. But the most important thing, as I've told you again, in this case, that's what I was thinking. The slide was like the shorter version. I was thinking generally these things I've replaced them with the full screen, the bigger ones which are there. It's all right. In this case, larynx, please focus on these things. Nose, nasal cavity. No, don't worry too much. No, don't stress too much. Um, uh, In this lateral wall of the nasal cavity, please focus on this slide for you to identify some questions, if at all, if it has been asked. Please use them. Because gross anatomy of the lung, it is also important for you to identify the lobes, fissures, and all these things with the models, what they have. And in this case, this one can be given as a model. If it has been, if there are models are there, it can be asked as well, this one, okay? No need, don't worry too much about all these things. Paranasal again, openings where each of these paranasal air sinus opens. This table is important. Okay, so in this particular slide, this particular topic, paranasal air sinus, because paranasal means surrounding the nose within the bones. What are the air sinuses we do have, and when they are present with surrounding the nose, they will be opening into the nasal cavity. So where these things open, you see these frontal sinus, maxillary sinus, ethmoidal air sinus, and these sphenoidal and all these things. Okay, so where do they open? Those are the things which are important. So particularly this slide is important. Okay. Um, Now again, this is the same slide they're showing you to see the lateral wall of the nasal cavity. This particular slide where the paranasal air sinuses are opening, these things are important. And then when we move on to pharynx, pharynx, just know the parts like from where to where, base of skull to C6 level, which can be divided into three parts. Behind nose, nasopharynx. Behind oral cavity, oropharynx. Behind larynx, it is laryngopharynx. Lower end of pharynx will continue as esophagus. Okay. So in these, don't worry too much. Nerve supply of pharynx, important. You can talk about the nerve supply because all muscles of the pharynx are generally supplied by vagus nerve, except for the stylopharyngeus, except for one muscle. Whatever names of the muscle that come ends with pharynx and pharyngeus and all these things, they will be supplied by vagus nerve, except for this stylopharyngeus, which will be supplied by glossopharyngeal nerve. Okay. Nasopharynx, this topic can be like they can ask you to identify few things. Okay, if it has been asked in your earlier exams, it won't be asked, or else this can be your question in OSPI. They can ask you this. Okay, the opening, the major ones will be the pharyngeal opening, and then the elevation over there, and then the behind the elevation, this is the tubal elevation, right? Behind the tubal elevation, you get the recess, pharyngeal recess as well. And in the tubal elevation, you get the tubal tonsil. These things, no need, don't worry. So those are the things which you need to remember. Larynx. Larynx nerves. I'll go back to this because um, again about unpaired and paired cartilages. You can all read through them because the pictures have given you clearly about thyroid, cricoid, and epiglottis, the three unpaired cartilages. Then we have two paired cartilages as well on both sides, two arytenoid, two cornicate as well, and then the cuneiform, which is in this fold. These, for time being, you don't need to worry too much about them. You read about the cavity of the larynx. So cavity, you have the supraglottic cavity, you get the ventricle, and below the vocal folds, you get the infraglottic cavity. So the cavity of the larynx can be divided into three parts. So above this is all supraglottic cavity. Here you get the ventricle, and below the vocal cords you get is infraglottic cavity. The space between the two vestibular folds. Vestibular folds are the false vocal cords. The upper fold are the vestibular fold. The lower folds, what you see here, is the true vocal folds. Okay, these are the true vocal folds. These are the vestibular folds or the false vocal cords. The space between the two vestibular folds is called rima vestibuli, and the space between the two vocal folds, it's called rima glottidis. Okay, and this is very important because that is the one which is closing and opening and creating this sort of sound which is coming up, which is responsible for voice production as well as for your breathing as well. What happens when these two things close? You will not be able to breathe. Okay. And in that case, that is what like this happens. So when you're whispering, how this they lie together, and during forced respiration or during normal respiration, you see always a gap in them. Okay. And what about what is important other than that? Like all these things, you can go back and learn. The most important one here is the posterior cricoarytenoid, which is the muscle which is over here. This is oblique and this is transverse. The posterior cricoarytenoid, the most important one, what you need to know is because that is the only thing which is going to help you in uh, abduction of the vocal cord. Abduction means opening up. All the other muscles, they will be helping you in adduction. You see like how abduction, adduction, opening and all those things are there. So one second now. You see this one, this is the posterior cricoarytenoid muscle. From cricoid to arytenoid, you can see. So it's called posterior cricoarytenoid. This one. So you can go back. Nerve supply, please learn this nerve supply even during sometimes in MCQs and these things. This is where mostly questions will be asked about. Okay, nerve supply of larynx. I've told you all these things are explained here. You see, one nerve comes up, comes down, which is superior laryngeal nerve, dividing into internal and external. External descends down while internal goes in. From below, you have this recurrent laryngeal nerve coming up. So for muscles, all muscles are supplied by recurrent laryngeal nerve except this one muscle which is on the outside, cricothyroid, which will be supplied by external laryngeal. All other muscles about larynx, whatever you muscles you learn, they'll all be supplied by recurrent laryngeal nerve. Okay. For sensory nerve supply on the inside, above vocal cord will be by internal laryngeal nerve, below vocal cord it is by recurrent laryngeal nerve. Why do we need sensory? Because we need, if any food particle goes into the larynx, we may need to cough them out, right? So how do you know when something is inside? That is where the sensory nerve supplies are going to help you. So internal laryngeal nerve, recurrent laryngeal nerve. But for motor, meaning muscles, will be all supplied by recurrent laryngeal nerve except one muscle, cricothyroid, which will be supplied by external laryngeal nerve. So this slide is particularly very, very important for you to understand. This one is superior laryngeal and inferior laryngeal artery. Laryngeal per se is not very important. We should be focusing on superior thyroid and inferior thyroid. If you're not happy, then we'll talk about that later. Superior thyroid and inferior thyroid artery is important for you to know. Why? Because it will be superior thyroid artery will be accompanied by, as you can see, this is a superior thyroid artery, which will be accompanied by external laryngeal nerve, while inferior thyroid artery will be accompanied by recurrent laryngeal nerve. So when there is a lesion, maybe you can go back to endocrine module and learn about the importance. Sorry about that. So it is important for you to know about this recurrent laryngeal nerve injury and external laryngeal nerve injury with superior thyroid artery and inferior thyroid artery. Okay, so these are all the things that can happen with the laryngeal nerve injuries, which we can see over here. Okay, you guys fine with this? So in this particular slide, larynx, please focus on the injury, which can be partially covered with endocrine system as well. You should know about the nerve supply of the larynx. You should know about the nerve supply of the larynx, and then in the nasal and paranasal sinus, please focus on paranasal sinus opening into it. About pharynx, nasopharynx, the lateral wall of nasopharynx is important. Lateral wall of nasal cavity is important, and then this cavity of larynx. In larynx, cavity of larynx. So those things can be asked in OSPI. If it has been asked earlier, then it might not be asked. Any doubts? If not, then I'll ask Prof. Tinmo to join for in the same meeting. I'll ask her to join. Okay. So don't leave the meeting. I've asked Prof. Tinmo to join the. Just wait for a minute. She has agreed. She'll join a while.